Well, good afternoon, everybody. There's a lot of chatter in the room. Thank you for joining us this afternoon. Still lots of chatter. This is good. This is good.
Recording in progress.
Now you've got to be quiet. First of all, welcome to everybody here in the room, and welcome to our colleagues who are joining us by Zoom. It's great to have everybody here. I'm so glad you've joined us, both in person and online, to celebrate and learn from an amazing professor, Stella Babalola. As I'm sure everybody knows, these Dean's Lectures give us a chance to hear from our newly appointed or promoted professors, as well as our senior scientists. This series allows us to learn firsthand how our colleagues are changing the world through the power of public health. Now, I have to say, I've always been blown away by these lectures because they really are a testament to the breadth and depth of what we do here at the School of Public Health. And it's a reminder that we have really true superstars here on the faculty at our school. And speaking of superstars, today I'm delighted to introduce Dr. Stella Babalola, a professor in the Department of Health, Behavior, and Society, and a longtime leader at our Center for Communications Programs, or CCP, as we fondly know it as. She is currently the director of its Research and Evaluation Division. In her own work, Stella is an expert at using research to support the design and evaluation of social and behavioral change interventions. Throughout her career, she has studied everything from sexual attitudes and behaviors among African youth to factors influencing the uptake of childhood immunization to the role of social norms in HIV testing. But no matter what she's focused on, Stella is always working to inspire and enable people around the world to make healthy choices for themselves as well as their families. Now, Stella comes to this work with a very wide perspective. She grew up in Nigeria, speaking Yoruba, earned her PhD in France, and is now working in the United States and across many African countries. She was instrumental in the early development of research capacity and approaches at CCP. And in fact, she joined CCP on its very first country-based USAID agreement more than 30 years ago. Her global and cross-cultural perspective has been crucial to how CCP approaches its work overall. And Stella is much loved and admired by her colleagues at CCP. In fact, let me just take a moment and tell you how the faculty and the staff at CCP described her. Uh-oh, we're getting feedback? No? Okay. So here are some quotes from faculty and staff. So first, Stella is a straight up data genius. Not bad. Stella is an energizer bunny when it comes to writing journal manuscripts and articles. Stella is committed to capacity building and is always an advocate for empowering local leaders. Stella is an innate manager and knows how to listen and how to balance different points of view. And Stella has no drama, no politics, no ego, just a desire to move work forward effectively and help people most in need. That's a pretty exceptional set of talents, skills, and qualities. So you won't be surprised to hear that Stella has done some impressive work here at this school and across quite a spectrum of pressing public health issues. Her research has shown that building the support of religious leaders can improve contraceptive use. She has demonstrated that cultivating positive attitudes about mosquito nets can encourage people to adopt this life-saving practice. And she worked with colleagues to launch a global survey to better understand beliefs, behaviors, and norms related to COVID-19. This effort in particular spanned 67 countries and yielded over 2 million responses, providing a large-scale, rich set of data on how people think and act during a pandemic, a global pandemic, I might add. Beyond her work in research, Stella truly shines when it comes to being a mentor. She has twice been the recipient of the prestigious Carnegie African Diaspora Fellowship. This allowed her to travel to Nigeria and South Africa, where she led capacity building workshops for hundreds of graduate students and faculty. In fact, throughout her career, Stella has worked closely with researchers in sub-Saharan Africa and has helped many to launch successful careers of their own. Stella's impact on public health is being multiplied every day by the work of the many mentees and trainees whose lives she has touched. Using her invaluable expertise and perspective, she is ensuring that our school creates opportunities that lift everyone. Dr. Babalola, we are so grateful for all you've done for the school and for the field of public health, and we're so excited to have you here with us today, and we're looking forward to your remarks. Stella.
Thank you so much, Dean Mackenzie. You don't see from the outside, but I'm blushing from the inside. Thank you so much. And thank you all for coming here today. I'm going to be talking this evening about the work that we at the Johns Hopkins Center for Communication Programs are doing, using the ideation model to design and evaluate social and behavioral change communication programs. And also the lessons that we have learned over the past 25 years. For full disclosure,
I got it.
Okay.
Keep going.
Thank you. So for full disclosure, I want to say that the research, the products, and the programs that I'm going to be referencing here today are due to the work of Johns Hopkins Center for Communication Programs worldwide. Let me start by taking a walk down memory lane. The field of social and behavioral change has come a long way. In the 1980s, we were talking about information, education, and communication, which is, where the emphasis was on developing and disseminating communication materials, to raise awareness and increase knowledge about health problems. But it soon became clear that, changing behaviors required much more than just raising awareness and increasing knowledge. It requires a strategic approach. Then came the 1990s, and the emphasis shifted to behavior change communication, which is the use of strategic communication, theory-based approaches to change behavior by addressing knowledge, addressing beliefs, addressing attitudes, and other psychosocial variables. However, we soon realized that focusing efforts at the individual level alone was not going to be enough to bring about sustainable behavior change. Then around the year 2000, the emphasis shifted to social and behavioral change communication, which recognizes the importance of social and gender norms in sustainable behavioral change. SBCC, as we call it, uses strategic communication approaches to effect change at the community, the interpersonal, and individual levels. Today, we talk about social and behavioral change, which is a comprehensive approach that seeks to change behaviors by addressing physical, structural, normative, interpersonal, and psychosocial barriers. SBC relies on communication, behavioral economics, and other approaches. There is no gainsaying the fact that sustainable behavioral change requires a comprehensive approach that targets factors at various levels of the social ecological model, at the individual level, at the family and peer networks level, at the community level, the health system and service provision level, as well as even at the societal level. The ideation model that we are going to be looking at today informs activities at the community, the interpersonal, and the individual levels. That's my colleague. I'm looking at in the room whether he's there. Kate. So what does ideation mean? In 1996, Van der Kar defined ideation as views and ideas that people hold about a behavior individually. Kincaid, in his 2000 paper that we are going to be referring to again later in this talk, provided a more detailed definition of ideation as new ways of thinking and the diffusion of those ways of thinking by means of exposure to mass media and social interactions in local, culturally homogeneous communities. In other words, ideation connotes ideas and views that people hold about behavior or the ways that people think about specific behaviors. The ideation model. The suggestion that behaviors could be due to ideas or thoughts actually dates back to the 18th century German philosopher Hegel and was later developed by Max Weber and Louis Dumont. For example, Dumont in 1909 argued that this desire to improve one's position economically, politically, and the areas of education and culture led to increased individualization, which in turn led to decreased fertility in France in the 1890s. Another French scholar, Landry, saw the decline of fertility as a reflection of prevailing thought patterns and the increasing rationalization of behavior. All of that, pointing to ideation. While the notion that ideational and cultural change has an important role to play in demographic transition did not completely disappear from demographic transition discourse of the mid-20th century, it was considerably overshadowed by the classic demographic transition theory, which says the role of modernization and economic development. It was not until the 1980s that the ideation argument started to become prominent again in demographic literature as an alternative explanation or a valid addition to the classic demographic theory for explaining demographic transition. Now let's take a look at the model. Okay, oh, I'm so sorry. Yeah. So the ideation model posits that intention is the most proximate determinant of behavior, which is an argument that is common to many theories anyway. It posits that communication in all its forms, whether we are talking about skills building for providers, whether we are talking about directive or non-directive forms of communication, or even whether we are talking about advocacy, communication in all its forms for communication to change intention and thereby change behavior, it has to change these items in the middle. That is, it has to target the skills and behavior, whether we are talking about, skills and knowledge of providers. It has to target the ideation of individuals. It also has to address environmental barriers. And we see that, those factors in the middle, skills and ideation and environmental factors, they do have a direct effect on intention and thereby on behavior. It is also important to note, this feedback loop, between these three items in the middle, skills and knowledge, ideation and environmental constraints, and behavior, in the sense that, when behavior improves, ideation is also likely to change. So there is a feedback loop. Ideation, the ideation model, what we popularly call ideation model, has been known by other other designations, other names in literature. For example, in his 2000 publication, Kincaid called it a model of strategic communication and behavior change. In another publication, he referred to it as a meta-model of health communication. Whatever we want to call it, the underlying assumptions are still the same. The elements are still the same. And it's also important to note that ideation is only one of the group of factors in this model. So the ideation model, it is a predictive model. A key underlying assumption in the ideation model is that the ideational variables have synergistic effects. Okay, they work together to influence the outcome. All the additional variables can be influenced using appropriate SBCC approaches. Over the years, the addition model has been used as the basis for developing and for evaluating social and behavioral change interventions for family planning, for adolescent reproductive health, for maternal and child health, for malaria, for COVID, zoonotic diseases, for neglected tropical diseases, for water and sanitation, and much more. So I'm going to focus on how we have used the ideation model to understand behaviors, to evaluate interventions, and to develop interventions and to evaluate the interventions. So the ideation model has been used, in countless qualitative, quantitative, and mixed method studies to understand the factors underlying specific health and non-health behaviors. I'm going to start with family planning and reproductive health. The ideation model has been used to explore factors associated with various reproductive health-related behaviors, including adolescent reproductive health, contraceptive use, and maternal health. And I'm now going to give some examples of how we have used the model in the past to explore factors related to family planning and reproductive health behaviors, starting with adolescent reproductive health. So this 2006 paper in Tanzania found that the most significant correlates of consistent condom use among young people was, they were different for young men and young women. For young men, the factors that were important, that were significant, included perceived self-efficacy for correct condom use discussions with friends, and perceived self-efficacy to use condom with a long-term partner. For women, the important factors were perceived self-efficacy to refuse sex if the partner refused to use a condom, and perceived self-efficacy to say no to somebody that one is really in love with. When the person says they cannot use a condom. Plus, also there was also discussions with a sexual partner. This paper on advanced maternal age and high parity. As we know, advanced maternal age and high parity have been linked to increased risk of maternal and child morbidity and mortality. The study that we conducted in Niger and Togo used concepts from the ideation model as well as social models in a qualitative research to assess the drivers of advanced maternal age and high parity. The findings show that the key drivers include beliefs about the role of women, family size preferences, risk perceptions, perceived marital insecurity, especially in the context of polygamous union, social, gender, and religious norms. Findings from this survey informed helped us to develop it, informed the development of an implementation kit with guidance and tangible tools to address advanced maternal age and high parity through social and behavior change communication. So that paper was in 2018. This paper in 2015 focused on, sexual pleasure, partner dynamics, and contraceptive use. The study found that method choice, that is, which method a woman or a man would adopt, and consistent use of that method are influenced by personal sexual desires in terms of the frequency and the quality, spontaneous, uninterrupted, satisfying sex, perceived quality and quantity of sex desired by the partner, because it was all about satisfying the partner so that the partner doesn't go elsewhere. Women's perceived role of providing pleasure to their sex partners, and of course also perceived side effects of modern contraceptive methods. Now let's look at childhood immunization. In the early 2000s, with funding from DFID, CCP led a series of qualitative and quantitative studies to explore the determinants of the uptake of childhood immunization in Nigeria. The studies were informed by the full ideation model. Again, remember that full ideation model, that is not just about the individual, and allowed a comprehensive look at not just the ideational factors, but also provider and environmental factors. The first of these studies was qualitative and was conducted in 2004. It provided the basis then for the household surveys that were conducted in 2005 and 2007. Collectively, these studies fostered our understanding of the factors affecting childhood immunization practices in Nigeria. A few journal articles came out of those studies. This BCG manuscript, that study found that, BCG immunization studies status, BCG is supposed to be taken immediately the child was born, but that's not the case in Nigeria, at least for many children. This study found that BCG immunization study is influenced by multiple layers of factors, including child's characteristics, including parental or household factors, and community characteristics, vaccine supply, and the policy environment. In terms of the parental and household factors, those include maternal use of antenatal care, maternal knowledge about immunization, maternal exposure to child health information, social influence, and especially paternal approval of immunization. These findings raise the need for interventions at multiple layers in order to increase BCG immunization status. I'm going to skip this and talk about this one. The determinants of DPT3 uptake. The study found that the most significant correlates of the uptake of DPT3 include child's place of birth, presence of an immunization card, child's mother's ideation, again, how the mother thinks about immunization, mother's decision-making power, and perceived social approval of immunization. Let's look at malaria. I want to specifically mention our malaria behavior survey. Using the ideation model, we developed a standardized validated tool that is refined through an iterative process. The main goal of the malaria behavior survey is to inform SBC strategies and programs, whether we are talking about the national level or subnational level. The MBS is meant to fill the gap in DHS demographic health survey, MIS malaria indicator survey, mixed multiple indicator cluster survey, by accessing behavioral determinants, including psychosocial, contextual, demographic factors. as well as, of course, assessing exposure to programs. The survey is designed to identify and understand the factors associated with key malaria-related behaviors, including the use and care of mosquito nets, adoption of intermittent preventive treatment of malaria in pregnancy, prompt and appropriate care seeking for fever in children, adoption of seasonal chemoprevention, and so on. The tool is modular in the sense that we have various modules that countries can adapt. They can decide to include or exclude certain modules depending on the strategy that they have for malaria prevention and treatment. But the overall, it consists of a household too, a women's questionnaire, and a men's questionnaire. The Malaria Behavior Survey is funded by PMI and implemented in 12 countries between 2018 and 2023. There are others that are planned for 2024. It is usually implemented in close collaboration with the NMCP, the National Malaria Control Program, or its equivalent in the country, and of course, other in-country partners. It has informed the development of national malaria SBC strategies in many countries. It provides an opportunity for capacity strengthening because we work very closely with our in-country partners right from the start, and they participate in every step of the implementation of the survey. Now, data from the MBS and other similar surveys have been used to assess the factors associated with malaria-related behaviors across countries. This manuscript on improving malaria control by understanding behaviors discusses how the ideation model can provide a better understanding of how individuals, families, and communities take action and adopt habits to protect themselves from malaria. The manuscript on consistent use of bed nets. Oh, excuse me. So this third one, the manuscript on consistent use of bed nets in 3 countries. In that manuscript, we use multi-level logistic regression. And the results show that self-efficacy to use ITN, insecticide-treated nets, positive attitudes towards ITNs, were the variables associated with consistent use in all the 3 studied countries. That is Cameroon, Côte d'Ivoire, and Sierra Leone. Other additional variables were associated with the outcome in 1 or 2 countries, but not in all 3. And that is something with ideation. It is not one size fits all. It is context specific, as we will see later. And also, the study also showed that household net sufficiency, that is, does the household have enough nets given the number of people in the household, was also very much positively associated. Again, pointing to the fact that yes, structural factors matter. It's not just about the ideation, but also pointing to the fact that even in the presence of structural factors, ideation matters. COVID-19, we have used the model to design studies on COVID-19. For example, with funding from Facebook, we collaborated with researchers from MIT to conduct several rounds of a global survey on COVID-19 behaviors and perceptions among Facebook users. The survey was fielded between July and March 2021, July 2020 and March 2021 in 67 countries. There were several rounds of the survey. And we had over 2 million responses. CCP contributed questions based on the ideation model to the survey too. The global data set from that survey is publicly available for researchers who are interested in doing secondary analysis. And several studies have already been published using the data. One such study is this one, Trends in Hand Washing. The study found that the relevant variables that are associated with hand washing, regular hand washing, include perceived effectiveness of hand washing, again, talking about the response efficacy, knowing someone diagnosed with COVID-19, and perceived importance of personal action for COVID prevention. Let's look at sexual and gender-based violence. As some of us may know, the Democratic Republic of Congo, DRC, has one of the largest concentrations of people who have experienced sexual violence in the world. Between 2012 and 2013, CCP worked with the International Medical Corps, IMC, to conduct a mixed method research. Okay, we won't allow that to disturb us. Okay, so we saw between 2012 and 2013, we worked with IMC to conduct this mixed methods research, and the data informed IMC's comprehensive strategy, social and behavior change communication strategy, to address the needs of GBV, gender-based violence, survivors by changing community attitudes around gender and violence. Again, several articles came out of that study. The dimensions and correlates of negative attitudes. This first paper. Okay. In that paper, we found that we identified four dimensions of attitudes towards survivors. And these include victim responsibility, victim denigration, victim credibility, and deservingness. One thing that we found that maybe we were not expecting was that gender role attitudes represented the most significant correlate of each of these dimensions. The findings indicate that changing negative gender norms should be part of a comprehensive approach to improving the lot of survivors of gender violence in the DRC, by focusing on these attitudes that we identified. Perceptions about survivors. This is a very interesting study that we published with Nichi John, used to be a student at here in the school. Now, so perceptions about survivors of sexual violence in DRC, in Eastern DRC. In this article, we use qualitative studies, qualitative data to contrast community reactions towards survivors, the descriptive norms. How do they view, how do people in the community view and treat people? And then with perceptions of what will constitute justice. So again, one way to look at injunctive norms. So we contrasted descriptive norms, what's going on, and injunctive norms. And we find huge amount of disparities between descriptive norms and injunctive norms. The image of a survivor of sexual violence that emerged from the data, the way that people see, that the community members see a survivor, was that of a person that should be pitied, a person who is sick, a person who is suffering, a person who is often abandoned and neglected, a person who is exposed to discrimination, and someone who is emotionally disturbed. In contrast to these negative perceptions, we found that in terms of what will constitute justice for survivors, people see compassion, they see empathy, they see egalitarian treatment, and they see respect and protection from taunting and labeling. We drew on the theory of pluralistic ignorance to explain these differences, because people actually don't talk about it. They don't talk about it, so they might not know what others are thinking. They might have false beliefs about what others believe. Okay. Now, let's look at how we have used ideation model to develop SBCC strategies and programs. Typically, when we collect data, using the ideation model, or any model for that matter, CCP staff, in-country SBC experts, Ministry of Health officials, representatives of the intended audience, and other stakeholders would meet in a multi-day workshop to develop strategies and materials. The model has informed the development of several global and country-level strategy documents, and I'm going to just show a few of those. With significant input from some of my colleagues, some of whom are present here now today at CCP, the ideation model informed the development of key rollback malaria standard of practice documents, including the malaria social and behavior change communication indicator reference guide and the strategic framework for malaria social and behavior change communication. The ideation model has also informed the development of national SBC strategies for malaria control in several countries, including in Côte d'Ivoire, in Malawi, in Liberia, in DRC, in Cameroon, and many more. We have also used the model to inform national SBC strategy for integrated family planning, for integrated health, for family planning, for GSA, for COVID, and much more. The model has informed the development of countless SBC materials. For example, this malaria TV jingle from Nigeria. It is in the jingle itself is in Nigerian English, Pidgin English, but it has subtitles. Let's hope that it works.
Wait this. Last time when you come, you say you know they fit well. How your body now?
As I go clinic, go do test. I get malaria. As I begin take my malaria medicine, I can't begin well. I'm not even finished the medicine safe. I say make I save the rest of the medicine for another time. Mama put. Wait with this now.
And the saving technique where you know take finish your medicine, now say make I use for you. So that when you go, come back, when better hungry don't catch you where you come back and shop the food.
Mama put, see, we just see what you give me so. Better hunger go come wire my belly.
If you not treat that malaria, if it's plenty for your body, and you see that medicine where you save, you know can't reach to treat them.
I don't hear. Sense, mama. I receive sense, so I go do am correct now.
Receive sense, so do am correct.
Fever na sign of plenty different diseases dem, plus including malaria.
Do test. If na malaria, then go give you correct medicine.
Okay.
Wait this.
Goodness. And there's also this one, on the advantages of sleeping under a net. The first one was about, taking the full dose of malaria treatment. So this one is in French, but
Je ne
it's
prends aucun
subtitled.
risque. Je le protège.
Même avec la clim, c'est elle qui m'a su une nuit paisible.
Dans mon état, il n'y a rien de tel qu'une bonne nuit paisible.
Je ne joue pas avec mon sommeil.
En plus de passer une nuit tranquille, la moustiquaire protège contre le paludisme. N'oubliez pas les bons réflexes contre le paludisme.
Ceci est un message du ministère de la Santé et de l'Hygiène publique.
Okay. I want to highlight the Nori project, funded by Bill and Melinda Gates Foundation. The Nori project is in Nigeria is an example of, par excellence, is an example of using the ideation model to design and evaluate a comprehensive family planning program. The ideation model informed not just the demand generation component, but also the service delivery and advocacy components. The program recognized that communication is the driver of this change, the desired change at every level, from demand creation at the individual level to supportive supervision and training at the interpersonal level, and to advocacy at the policy level. This is an example of the use of the comprehensive ideation model. The TV jingle that I'm going to share now addresses the misconception that contraceptive use might lead to infertility.
Now, blessing be this.
Nah, sure. She
Blessing
don't
don't
reach 3 years
grow
now.
finish. Me na sit down.
God.
How are you? Good. So, wetin come bring una come our place today?
I never see my period this month.
That one na better news now. Abi no be so?
We've been the wonder.
No. You no need to worry at all. Anytime when you stop your family planning method, you fit get belle sharp. So, Mama Blessing, go check.
Now, wow.
Blah, blessing. You don't score another goal.
Eh?
Hey! You don't
Auntie
score.
Nurse.
Yes, so.
Thank you. You do well for me. But you, thank you.
That's
This
all.
family planning team, good though.
If you want do family planning, una informate where you want. Waka go any clinic. We get the blue, yellow, and orange logo. Where they call Get It Together. Now, FCT Health and Human Services Secretariat bring una this Get It Together campaign.
I also want to share this because it has another dimension. This is from Indonesia. It discusses the benefits of long-acting contraceptives. Let's quickly listen. Okay.
Bahagiaku dimulai waktu aku memilih Bambang. Lalu kami merencanakan keluarga dengan menunda hamil. Abis disulung lahir, aku pakai IUD. Kenapa teh? Lebih aman dan gampang memberi jarak. Mau hamil lagi tinggal lepas. Pas anak cukup, pasang lagi. Itu resep bahagiaku. Rencanakan dari awal, pilih metode yang tepat.
Jadi, bahagia itu bisa direncanain.
Tuh, pilihanmu datang.
Kang, besok kita konsultasi ke bidan yuk.
Yuk.
Thank you. Okay. So, to address the pervasiveness of sugar daddy syndrome intergenerational sex across Cote d'Ivoire, CCP created the Supergirl campaign as part of a PEPFAR-funded Next Generation of SBC project. The Supergirl campaign seeks to address, to increase the practice of safer sexual behaviors among male and female youth and increase the discussion of sexual matters between partners. Campaign messages were based on formative research informed by the ideation model. Through a series of television spots on abstinence, faithfulness, partner communication, as well as leaflets and other promotional materials, Supergirl, an empowered cartoon female figure, encourages young women to take responsibility for their lives and make wise decisions about sexual relationships. Now, let's see how we have used the ideation model to assess the effects of SBC programs. Over the years, the ideation model has demonstrated its worth not only in helping us to quantify the effects of SBC programs on behaviors, but also in helping us to understand how SBC programs work to change behaviors. The Kincaid study used The Kincaid study 2000 used longitudinal data from the Philippines to estimate the effects of a mass media campaign on contraceptive use. It found that the best predictors of contraceptive use were pre-exposure level of ideation, pre-exposure contraceptive use, and current ideation. He also found that the strongest predictors of current ideation were pre-exposure, that is baseline level of ideation and exposure to the campaign. Finally, he found that campaign exposure has a strong indirect effect on contraceptive use that passes through ideation. This again underlines the importance and the value of ideation. In 2009, Larry Kincaid and I published this landmark paper on methods for evaluating the effects of health communication programs. The paper emphasized the importance of using a theory-based approach and included examples of analysis linking additional variables to behavioral outcomes. Let's now look at specific examples from family planning. This study from Burkina Faso, I believe in 2006 or so, showed that personal advocacy in favor of family planning, knowledge about contraceptive use, and discussion of family planning are positively associated with contraceptive use. The analysis further found that what made a significant difference for contraceptive use is considerable exposure to the campaign. At a high level, the campaign had significant direct effect on contraceptive use, which is not absorbed by the additional variables. In contrast, at a low level of exposure, much of the effect of the campaign is indirect and filtered through the additional variables. Using data from the 2013 DHS in Nigeria, Olamide Oyenubi and I, we applied a nonlinear decomposition technique to determine the contribution of social, demographic, and socioeconomic characteristics, conjugal relationship dynamics, intimate partner violence, ideational variables, and Islamic culture in explaining the North-South differentials, disparities in contraceptive use. For those who are familiar with Nigeria, there is a huge difference between the North and the South in terms of contraceptive use. The largest contributor to the gap, to explaining the gap, were additional characteristics. Again, so the way people think about the behavior. In the achievement of fertility intention paper, using longitudinal data, we found that the strongest predictors of the achievement of fertility intentions included, of course, parity, age, religion, residence, but also spousal communication about family size, perceived severity of another pregnancy, and spousal agreement about family size. Malaria. So how have you used this to evaluate the effects of campaigns on malaria-related behaviors? Both studies that we are looking at here use mediation analysis. Mediation analysis to assess the role of ideation in the effects of communication campaigns on malaria-related outcomes. The Nigeria study, led by Matthew Oko, found that after adjusting for recall of media messages and other covariates, ideation had a significant positive direct effect on consistent bed net use. There was a significant indirect effect of exposure on consistent bed net use, but it is through ideation. So again, the importance of targeting ideation. In the Tanzania paper, led by my colleague, Emily Rikota, we found that exposure at any level was significantly associated with increased net ideation. Net use ideation also significantly increased the odds of having enough nets within the household. The study, however, found no significant direct effect between exposure and universal coverage when we have controlled for ideation. Again, saying that the effect on the outcome was through ideation. Now, as we begin to wrap up, let's look at what are the lessons learned. One thing that is constant with the ideation model is change. The model has evolved over time and will continue to evolve. Continuously, the model is being informed by new learnings in the field. As we learn new things, we go back to the model and say, oh yes, maybe this should be part of the model. We are never satisfied until it is perfect. Yeah, I don't know when it's going to be perfect, but anyway, we continue to use new learnings to inform the model. For example, currently we're actually exploring ways to strengthen the emotional dimension of the model. But In spite of all these changes, the basic idea remains the same, that to change behavior, target ideation. We have also learned that the model is relevant, as we have seen today, is relevant across multiple sectors and behaviors. It's been successfully applied to understand health and even non-health behaviors. For example, in the field of democracy and governance, to understand school attendance, to understand anti-corruption behaviors like we have done in Nigeria. Formative research is needed each time to identify, what are the relevant components. We will need to use formative research to adapt the standard model. We have also learned that relevant components are behavior, time, and context specific. One size does not fit all. We have to look at what is the behavior that we are dealing with, what time, how far has the country evolved, gone, and then, look at the context, of course. There is also a feedback loop between behavior and ideation. As behavior improves, as behavior evolves, relevant ideational variables evolve too. What else have we learned? The more the merrier. The more ideational variables that are present, the greater the change. So we have found, over and over again, a dose-response relationship between ideation and behavior. That's been demonstrated in many studies. Here is an example from Indonesia, linking use of lack with level of ideation. So what is that saying? Programs should influence as many of the relevant ideational variables as possible, but it's not as bad as it sounds. Ideation mediates the effects of SBC activities on behavior. So we know that addressing relevant ideational variables is an important step. It is indispensable if we want to change behavior. Drawing on theory and best practices, we know that we need to address specific ideational variables. For example, we draw a lot on Bandura when we are dealing with passive self-efficacy. But why I said in the previous slide that it's not as bad as it sounds is that addressing one ideational variable may actually help us to see changes in others. For example, addressing descriptive norm might help us to see changes in perceived self-efficacy. Because as people see that this is common, people like me are doing it, then it helps them to start thinking, oh, if others like me are doing it, then I also can do it. Now, to the million-dollar question. Necessary but insufficient? Obviously, unique focus on psychosocial determinants cannot be sufficient to effect sustainable change. But the ideation variable is more than just the psychosocial variables. It is much more than that. Okay. The model recognizes the role of factors operating at levels beyond the individual, including service provision and even environmental factors. So again, what we need to do is draw on theories to see which ones and how do we address all the other components. Application of the comprehensive ideation model allows a holistic look at behavioral determinants. Moreover, we are now currently exploring, and this work is being led by my colleague Nanjita. We are exploring how to make the model more relevant to Africa and Asia by drawing on non-Western theories of behavior change. Wow. I am very grateful to many people. First of all, I'm grateful to God for his faithfulness every day in my life and in the life of my family. I am grateful to my parents, Festus and Sabina Uduwole, who put premium on education, taught me the value of hard work and integrity, and encouraged me never to limit my aspirations. Both of them are deceased now, but I can still hear my mom saying, Stella, those that achieve great results, they don't have two heads. They only have one. So if they can do it with your one head, you can do it too. So they encourage me never to limit my aspirations. I'm grateful to my family, my husband, and my 3 children for their support and understanding over the years. I was sharing with someone today that when my children were little, what I heard over and over again was, "Mommy's going again." I heard it over and over again. But you know what? They came out not too badly. I'm grateful to my senior colleague, Larry Kinkage, from whom I learned a lot. I'm grateful to my CCP colleagues, many of whom are here today. The work presented today is the result of teamwork and collaborative efforts. I'm grateful to my head of department, Rajiv Rimal, for his continued support and encouragement. I'm grateful to all of you for being here today. Thank you.
Sure, we have a few minutes for questions. Well, first of all, I want to thank Stella and for a wonderful trip down memory lane, if you will, and talking about the different studies you've done. And I really, really enjoyed the. I was having lots of questions as you were talking. I said, well, does this apply across different types of behaviors, and lots of questions. And in the last few slides, you answered all my questions. But I really thought you did a great job in summarizing the lessons learned, because in applying these kinds of models, it's important to take away those lessons. And especially appreciated what you said about continuously learning and updating the model. So it represents an incredible body of work, and I congratulate you on that.
Thank you.
But we have some time. Yes, question over here. We'll give you the microphone so that people online can hear you. Why don't you? Yeah.
Hi, Stella. Thank you
Hi.
so much for a wonderful presentation. I think I was just curious because your life experience seems so rich, and your research experience seems to all connect with that. And over the 25 years, I was wondering, was there any moment that came to you back, like full circle, like a full circle moment where, over the course of your career, you realized like there was something, a seed that was planted a long time ago that came back and grew into a tree?
Mm-hmm. Mm-hmm. Yeah, thank you. Of course, yes, there are so many of those moments. And, for example, before I came to the US, I was faculty in Nigeria. Then I came here for almost 10 years. I had nothing to do with faculty. And then all of a sudden, the opportunity came back. It was like, this is why, I came here. This is what I'm supposed to be doing. Yeah, so and there are many like that too. Thank you for that question.
Questions? Yes.
Stella, congratulations and thanks for a great presentation. I'm trying to understand better how ideation works in developing instruments.
Mm-hmm.
And so one question is, if I were to look at a survey and look at questions in a survey, how would I know that there was some component of ideation in those questions?
Mm-hmm.
What would they look like that would be different than questions with some other basis or with no theoretical basis?
Okay.
And my second question is, does ideation have to be about health? All the examples you gave were related to changing people's ideas about health. Mm-hmm. But what about changing people's ideas about something else that might influence their health behavior, even if it has nothing directly to do with health?
Mm-hmm. So I was trying to, now I've lost this, and I was trying to show the ideation model again. The ideation itself, there are 3 dimensions, the cognitive dimension, which is about attitudes, about knowledge, about perceived risk. And then there's the emotional one, which is about emotional response and perception of efficacy and so on. So each of those dimensions have several constructs related to them. And then each of the constructs we use several questions for many of them to measure. For example, of course, attitude. We cannot just use one item to measure attitude. Perceived self-efficacy also we use several questions, but it has to be relevant to the behavior. Yeah. So taking a questionnaire, hopefully, if this is a questionnaire designed for ideation, hopefully it will be labeled. You will see the labels, now this is perceived self-efficacy, perceived response efficacy. But that's how you would know, looking at the constructs inside each of the dimensions. Yeah, and then the second question.
Ideation related to things that may not be directly about health.
Yes.
But that influence health behavior.
Yes, no, so we've used it in the democracy and governance. As we were talking, I was thinking about Rwanda and Gacaca. We use it as we were trying to see how do we promote participation in Gacaca and acceptance of Gacaca. The courts, what do you call that now? The reconciliation courts in Rwanda. We've used it for anti-corruption in Nigeria. We've used it for many non-health sectors.
Other questions? Any questions online? If you can raise your hand, we can pick it up.
I think there was a question in the chat.
There is a question in chat. I can read it. Related to Dr. Harvey's question, some of the components of the ideation model seem to relate to agency, for example, self-efficacy, personal advocacy. How do you, how do you view the concept of agency with an ideation model? Is it a component, a separate construct, a different model of thinking about behavior?
Yeah. So thank you, whoever asked that question. Yeah. So in the ideation model, we do have decision-making dynamics, as part of the social interaction dimension. So that also might cover agency. Again, there is no reason why we shouldn't even, dig deeper into that construct of agency and see which ones we want to include. Yeah. So it's not just about the ones that we mentioned, but I think possibly maybe we missed out in this particular version of the model, decision-making dynamics. Yeah. Any other from online?
So Stella, I maybe wasn't as clear as I could have been about when I said ideation related to things other than health. I didn't mean the model applied to some other field. I meant, can we influence people's health behavior through ideation that's not related to health? In other words, I don't believe that sleeping under a bed net is going to protect me from malaria, but it allows me to sleep without being bitten by lots of insects. I think there have been campaigns about that over the years, peaceful sleep and so on.
Yeah.
And has there been any research done on what components like that maybe are most effective at changing health behavior that are not related to increasing health knowledge? Because we know that knowledge doesn't always change behavior. Thanks.
Yeah, thank you. The addition model is also, it's not just about health. What you actually mentioned is one of the perceived benefits of sleeping, and that's an additional variable of sleeping under a net. Yeah. So again, we have to do formative research to know what are the drivers and then focus on those drivers. Measure them to look at their prevalence and focus our messages there. Oh, that's my director. Thank you. Thank you, Deborah. I appreciate it.
Well, we'll definitely save the chat for you because there's lots of congratulatory comments in the chat. Any other questions? Yes, go ahead. Let's get you. There you go.
Hi, Stella.
Thank you.
Is there something that you kind of are hoping that in the future you could use the ideation model to explore and to understand better as a behavior or an issue that you're passionate about?
Yeah. Definitely. Yeah. For example, the issue of in the area of nuptiality, the issue of divorce, so that's something that I would want to understand, especially when it becomes so bitter and all of that. But who is going to fund that? But since you said personally, but jokes apart, I think I would want to see more of ideation model being used for water and sanitation for climate change related behaviors. Yeah.
Yeah. I don't know if I need the mic. People can't hear you online.
It just helps online.
Thank you, Stella. Excellent presentation and congratulations. I've been thinking a lot about the extended parallel process model, which has those elements that come under the cognitive part of the ideation model. And I wondered if you could comment on how you understand and see the relationship between different models, using those two as an example. Thank you.
Yeah, thank you. So, like you said, some of the elements in the EPPM are actually in our ideation model. For example, when we talk about the efficacy beliefs about response efficacy, beliefs about self-efficacy, and also the perceived threat. Am I vulnerable to this? Am I susceptible to have it? And also, is it severe? So all those are actually in ideation model. It's only the way that we treat those. The ideation model is, of course, more complex than the EPPM. But again, maybe something I didn't say is that all of the constructs within the ideation model are actually borrowed from other theories and models. Thank you.
Great. Okay. I think if there aren't any other questions, I just again want to thank Stella for an outstanding presentation and congratulate you on an incredible body of work. And we look forward to seeing what you do next.
25 years.
Yes. And thank you all for coming. Are there some people you'd like to introduce?
Oh, yeah. Let me introduce my children. Yeah. So that's Peter. Beside him is Deborah. Deborah was actually an alumni of Johns Hopkins. Yeah. And then I want to also introduce my son, my doctor's son.
Wonderful.
Thank you.
Well, thank you.
Of course, I don't need to introduce my fellow CCPAs, but I really appreciate you people being here. Yeah.
Well, thank you. And thank you all for coming. And thank you for those joining us on Zoom. Unfortunately, you cannot join us for the reception, but I do invite everybody here to join us in the gallery, and we'll have some receptions and continue to toast Stella on an outstanding presentation. And thank you for all you do.
Thank you.
Thank you. And thank you.